This is Teresa Moss for Advanced Health Assessment. The first thing we're going to show today is how to take a blood pressure, including a true systolic, by doing your radial pulse palpation. You want to get all your supplies together. You want to make sure that you have your blood pressure cuff, and you have your stethoscope, and you have your patient. You're going to put your patient in a comfortable position. They can be sitting or lying down. First thing you're going to do is you're going to apply your blood pressure cuff to the patient's arm, making sure the bladder of the cuff covers at least 80% of your patient's arm. You want to make sure you have at least an inch between the antecubital and the bottom of your blood pressure cuff. You want to position your meter so that you can make sure you can see it during your palpation and during when you're listening for your blood pressure. You're going to tighten your bulb to the right. The first time you're going to do it, you're going to feel for your patient's radial pulse. And while you're feeling for that, you're going to be pumping up your blood pressure cuff, feeling for when that radial pulse disappears. And it just left. We're going to go 30 above that, and we're going to slowly decrease until we can feel that radial pulse again. And right there I felt it at 118. You're going to release the pressure from your cuff by turning the screw on the bulb to the left, and then you're going to let your patient rest for about 30 seconds to 1 minute, and then at that point you can start taking your true blood pressure with your stethoscope. You put it into your ears. You feel for your brachial artery. You place your blood pressure, the bell of your stethoscope over the brachial artery, and at this point we're going to turn the screw of the bulb to the right again, and we're going to begin to pump up the blood pressure cuff, going 30 above where we felt the radial pulse come back, which was our true systolic. So we're right there at 118. And then we listen for the last cork off, and it is at 72. So her blood pressure is 118 over 72. And that's how to take a true systolic blood pressure